Treatment of early maternal thyroid insufficiency to prevent neurodevelopmental deficit in a newborn has been studied for several decades and demonstrated controversial results. New literature shows the efficacy of treatment with LT4, however, there is a lack of clarification regarding at-risk groups. The three primary factors to consider when defining early maternal thyroid insufficiency are the thyroid hormonal levels, the presence or absence of TPO antibody, and the definition of early regarding first or second semester. The study aims to develop a model for the early maternal thyroid insufficiency case definition based on the early maternal TSH and T4 or FT4 levels as either low, normal, or high, or with a clinical focus on hypothyroxemia and on subclinical hypothyroidism. Three recent studies have assessed the efficacy of LT4 therapy of MT on neurodevelopment, consisting of two randomized clinical trials, Lazarus and Hales Casey study and Chance comparison study, underlining hypothyroxemia and subclinical hypothyroidism. Case definitions used in each study will be examined and compared along with the study groups. The randomized clinical trial from the UK and Italy collected samples at age to 15 weeks with a median of 12 weeks and included hypothyroxemia, subclinical hypothyroidism, and overt hypothyroidism. The treatment dosage of LT4 was 150 micrograms per day, adjusted at 6 and 30 weeks later. No treatment effect was observed at age 3 or at age 9.5, except for some abnormal behavior recorded at age 9.5 among the overtreated. The study by Casey presents two multi-center randomized placebo-controlled trials conducted in the US, one for hypothyroxemia and one for subclinical hypothyroidism. Samples collected at 8 and 20 weeks with a median of 17 weeks were randomly assigned either to LT4 treatment group or to a placebo treatment group. Initial LT4 treatment doses were 50 micrograms per day for those with hypothyroxemia and 100 micrograms per day for those with subclinical hypothyroidism, and placebo to the placebo group. Children's cognitive and behavioral tests conducted annually through the 5th year of age did not show any neurocognitive or behavioral differences between the two groups of children in either study. The Chance study collected samples at a median of 6.5 weeks and separated participants into those with a TSH 2.5 to 4 and 4 to 10 treated or not treated. LT4 dosage was adjusted to maintain TSH between 0.5 to 2 units per liter. Intellectual development tests at age 2 showed reduced IQ scores in those with higher TSH levels, 4 to 10, who were untreated. In conclusion, we can say that most studies found no outcome differences between treated and untreated or euthyroid patients. The exceptions were increased abnormal behavior indices in offspring or of overtreated patients and IQ deficits in offspring of untreated TPO negative patients with a TSH 4 to 10 in the first trimester. Thank you.